Hello, everybody. My name is Steff Headcamp. I am the Communications Director of the Big Push for Midwives campaign. Welcome to Where's My Midwife, a podcast. I'm joined today by my co-host, Kirsti Kreutzer, co-founder of the Where's My Midwife, a podcast, as well as our special guest, Tanya Smith-Johnson. Tanya Smith-Johnson wears many, many hats, so hold on to yours because I'd like to introduce her at this time. Tanya is married to a wonderful man. She's been married for 21 years. She has 6 children, and they live together in Honolulu, Hawaii. Tanya is a certified professional midwife. She has a Bachelor of Science in Biology, a Master's of Science in Medical Science. She is an adjunct faculty member of the Midwives College of Utah. She is a member of the core faculty of the Florida School of Traditional Midwifery. She is a member of the Inclusion, Diversity, Equity, Accountability Advisor cohort there at the Florida School of Traditional Midwifery. She serves as the policy director of the Healthy Mothers, Healthy Babies Coalition in Hawaii. She is a former board member and vice president of the Midwives Alliance of Hawaii as the Oahu representative. She serves as the outreach, education, and advocacy director of the Big Push for Midwives campaign. She is a member of the Hawaii Women's Coalition and the Hawaii Commission on the Status of Women's Feminist COVID-19 Response Team. And she is a co-author of the nation's first feminist economic recovery plan in response to COVID-19. She serves as an appointee on the Birthplace Lab's Global Perinatal Task Force. She served as the former vice president of Californians for the Advancement of Midwifery, and she also served as the former president of California Families for Access to Midwives. Welcome, Tanya Smith-Johnson.
Can I just give some applause? That's amazing. That's a lot of hats. Yeah.
It sounds impressive when it's read out loud like that. I mean, that's pretty amazing.
Thanks for everything you do for moms and babies. That's amazing.
Thank you. Thank you.
Yes. And I believe you were teaching student midwives right before you jumped on with us, which is amazing. It's a weekend and you're still at it. In fact, I'm not sure when you're not at it. I know that sometimes you pause because I do see incredible pictures of nourishing food for your body. So I'm grateful that you do that self-care because we need you in this fight in all the ways that you are. So thank you again for making time for us today.
Yes, yes.
We're going to start with some slides just to keep us on track because there are so many things to talk about with regard to your work. Kirsti, thank you so much for pulling those up for us. Mm-hmm. Tanya, maybe just start though by telling us, before we dive into all the things, how you came to this work. What was it that brought you to this place where all these things that you're doing mean so much to so many?
Yeah, I think I always center my story around how did I get here as a birthing person and as a mother. And that's where every touch point for everything I do comes from. First, I was just a consumer who was looking for, a home birth midwife myself. And then after experiencing my first home birth with my 4th child, I was all in, and that midwife was already doing some advocacy work and asked me to jump on board. That birth was in California. I actually had that baby on Stanford's campus. Don't know if that was legal or not. They didn't know about it, but we did it in the graduate dorms there, and I was sold. And at the same time, soon after having that birth, I enrolled in midwifery school because I was pretty much all in, and that's the type of person I am. So started both. I started midwifery school with a new baby and started advocacy work with California Families for the Advancement of Access to Midwifery. And I started off as just an intern helping that midwife because, I just had a new baby and just kind of learning the ropes, that way, and, help push and pass legislation there in California. And from there, I kind of got the policy bug. I never thought about policy before that. I was told, that it would probably be, my wheelhouse and a great place for me to do a lot of work. I didn't believe it at the time. I just thought my place was to do just kind of grassroots, patient client care. I'm really good at that. I'm really good at, nurturing and nourishing others and caring for others. But seeing that I can do both and kind of juggle both of those, those roles really well was profound. So continued on through midwifery school. And the same time, became a part of lots of different organizations doing policy and advocacy work. As you heard in that beautiful rundown. And now I have my CPM. And so with that, I've been brought on board with Healthy Mothers, Healthy Babies here in Hawaii, working just really this policy angle. And even before that, just people knowing my work from the mainland wanted me to be a part of, this beautiful feminist recovery plan and really just write the parts of it that involve maternal health care and really talk about midwifery and uplift it in ways that have never been seen before. And really just, given this platform to just dream about what midwifery could be and how it can really upscale, uplift, the work that needs to be done on a just national scale here. And that's what I did. And it's gotten lots of beautiful response. And I've just been working all the ways, in that way. So just continuing on with, lots of advocacy, lots of policy work. In the midst of that, this past December, I was asked if I wanted to, come aboard to 2 midwifery schools at once in regards to being a professor and teaching. And so, so I feel like I'm real strategic. So I feel like I'm kind of hitting all the ways in which we do maternal health care better by uplifting, future and prospective midwives, by being a teacher, by working on the policy and advocacy work, and actually being a hands-on grassroots, practitioner and caring for people. And that's what I do. So yeah.
It's amazing.
Mm.
I want to jump to a lot of questions, but I want to get through some of our discussion. I want to also, if you just take a second and remember with me when I first met you. So I had the opportunity to facilitate an all-day Big Push Summit, a push summit, we like to call them. And it's been a long time now. It was basically Halloween time of 2019. And I, planned that with the Big Push Steering Committee, and I knew you were coming and I was excited to meet you. And I got to sit at your table, and I just remember being a little bit of a fangirl, like, oh my goodness, it's Tanya Smith-Johnson. And I felt like you had done so much in such a small period of time. I was just really taken by your energy, your clarity, your drive, your passion. And I say the next word with reverence, your righteousness, because so many people are apologetic in this work, or they're like, oh, is this okay? Is this enough? A lot of the grassroots advocates that we find that go to the Capitol, they're still sort of like, is it okay for me to occupy this space? And I never got that when I was with you, and was so much of a breath of fresh air for me, because it was just clearly part of your DNA to be this really strong force for good for our movement. So I kind of wanted to just sit next to you for the rest of the conference. And I think I tried, and we did a pretty good job. So and then shortly thereafter, I requested that we take it back to the steering committee to ask you to join the steering committee. And you said yes. So anyway, that was my remembrance. And I would love to just know, what you thought of the Push Summit, of that conference that we were at in Texas, and then anything else you want to share about that time.
Yeah, I think for me, that point was a crucial point for me. I was part of another organization that I felt didn't feel the same way you feel necessarily. Kind of took for granted the person I was and the work that we could do. And really just, I was in the place to where I was having to make a leap. And I was honored to be asked to, to come and be a part of that, Push Summit. I was still a part of that organization at the time. And after sitting there with so many people from, around the country and talking, about, just really just kind of big policy things and just everybody, just in my mind being a part of this think tank really of, some luminaries in the midwifery world, lots of grassroots people, and really feeling like I was at home and it was where I needed to be. And it was the place where I can do lots and lots of good. It was easy for me to I was kind of hoping, I manifested, I hope they ask me to be a part of something bigger. And it literally was something I wrote down. I was like, I want to be a part of something bigger, something national. And then Big Push came, asking me to be a part of the steering committee. And I leaped because it was something that I wanted and I manifested and thought that it was a perfect place for me. So yeah, so the same way in which you might have been fangirling, I kind of was too, being in the room, oh, these are people who are actually doing the work. And I want to be one of those people too. So yeah, and ever since then, we've kind of been rocking and rolling. And I feel like I was able to bring some new energy, into things and just really, get us excited about the things that we can do and just in many ways be unapologetic about it. Just be like, it's go time. And I think if anything in the, past year or two, we've learned that, time is of the essence and, it's no point of us, half stepping or being small in our acts and small in what we want. So, yeah, I'm happy to be in a place and a platform that allows me to be that expansive and do all the things that I envision I can do.
So what's really interesting for me too is, and we're gonna get to these slides, I swear. But what happened after that conference in the fall of 19 was we were heading into the spring of 2020, thinking we're gonna connect again. Tanya and I were gonna connect on the mainland. Obviously, Tanya's in Hawaii. I'm in the Midwest. We were gonna get back to Texas. We were gonna go back and meet with a core group of us from that Push Summit. And we were going to go back to that strategy think tank space. And we had a lot of ideas about what we're going to do. And then COVID, and we weren't sure. It was still early March. We were supposed to be meeting 1 year ago to talk about everything. And we decided, because one of our cohort was immunocompromised, that it wasn't smart. We needed to call it off. We didn't want Tanya away from her home if they started to shut down states and borders, and they started to do that. So that was a good call for us. So that was hard. But what was interesting then was the swirl of COVID and all the things that happened, right? So Where's My Midwife, the crowd map, that came into being. That's when Kirsti and I reconnected. And then Tanya, you went and did a million amazing things in Hawaii. And so if you could just take some time to take us back to a year ago and just kind of track forward. And I think the next slide is the healthy mothers, but just let's look and see what that next slide is, guys.
Uh-oh. Hold on 1 second.
No problem.
There we go.
Yeah.
Yeah.
So yeah, thinking about it, it has been a year. I think about it. It doesn't seem like it's been that short a period of time, but yeah, so pretty much October, maybe October is when I started to really just kind of be asked to be a part of some, kind of bigger picture conversations. I was already a delegate for the Birthplace Labs Home Birth Summit, but being, pulled from that as a small cohort of people to be a part of the Global Perinatal Task Force team, and to really work on these kind of best practices, guidelines, and really kind of put together this huge international resource in regards to ways in which we can move within the midwifery world and beyond in regards to COVID, so really just kind of, taking, thinking a think tank, just taking all these people who are part of all this, amazing work and putting it in one kind of spot so people can find the resources they need to navigate. So that's been amazing and an honor to be a part of that. But then from that, pivoting to being asked by the executive director of the Hawaii's Commission on the Status of Women to be a part of Hawaii's feminist COVID response team. And I didn't know at the time how big a deal that was. Of course, I was honored, and they looked at me as someone, who could be a valuable resource in regards to talking about not just midwifery, but maternal health care in general, reproductive justice. And sitting on that team, going from there to really, it was supposed to happen a little bit slower, but then, with, COVID funds and CARES Act money coming in, and the state talking about, its economic response, where it kind of pivoted to where the commission was asked to come up with a report, and the state in general was asked to come up with the report within a few days. And the ask was just like, hey, you all, this is our opportunity. Let's go. Let's write this, let's write it out. Let's dream it up. Let's write it out what it could be. And that's what happened. So it literally was less than a week. Everybody from the perspective, areas and fields of expertise wrote what it could look like. And we were given the ability to dream, the ability to, if we really were going to think about, a nation, a world even where we did everything right coming out of this, what does that look like? And that's what you see in that report. So out of that, came the Building Bridges, Not Walking on Backs report, and it's a feminist economic response to COVID. Beautiful, beautiful report that at this point has gotten lots of international attention. There have been other states that have made similar reports and actually put them into action. There have been other countries who've done the same thing. And even recently, I just spoke with UN Women as a part of their expert group in regards to a platform they had called Advancing Feminist Policies in the Wake of COVID-19. It talked about my role in writing, co-authoring and writing that report, and really just being able to present on this international level to people all over the world who really were fangirling over our report and really just wanted to know, like, tell us more, where did that come from? And like me just being this, I'm like, this is just little me, I'm just doing, what I do. But to be on this international stage and people looking at me and asking like, tell us how we do this and do this better. So it's been amazing. I almost get choked up thinking about it, but it's been so amazing because those are my words, and those are my thoughts. And to have it immortalized like that, have it to go all over the world and people really take it and take it as advice and take it to, to write their own country's policies has been beautiful. So yeah, and even, with that report, the executive director of Hawaii's Commission on the Status of Women just spoke at the congressional hearing in regards to COVID and economic policy. So she's the only state level person who's been asked to do that. And she spoke about the report and about the work that we did. So it was, huge. So yeah, so that happened. And even from...
So that happened.
That happened. And so even from, and to be named, because, I'm named in Healthy Mothers, Healthy Babies is named, but this was right before I was asked to come on to Healthy Mothers, Healthy Babies. And it's funny because when we were in that meeting, the executive director of Healthy Mothers, Healthy Babies was on that call. And I think she had heard about me and heard my name. And I think was in the process of setting up a meeting to like talk about like coming on board. And she's like texting me in the chat and she's like, hey, Tanya, nice to meet you. I've been meeting to meet you. And from there, like pretty much right after that, met with her and, same thing. Loved my work, kind of fangirling, she looked up all the things and she was like, I want you to be a part of Healthy Mothers, Healthy Babies. So, and really just to come and just bring, everything I have and dream up and really kind of think about this midwifery model of care that we can, create and bring here to Hawaii. And so I started on as that as program director for, that lovely program that now is called Mana Mama. And then after that, knowing the policy work that I've done, she was like, you know what? I want you to stay on as program director, but I want you as my policy director, and pivoted to, stepping in, to a position that was created for me as policy director and really push whatever it was that I thought was important. And I thought, one of those things is, to piggyback off of the Black Mama Bus. And it's like, we need to do something that's specific to, communities of color and center that and figure out how we do that. So from there, I wrote legislation and pushed a bill, and just to have all the support on the ground to have people really, just giving me this platform to just kind of go. So we presented, the bill was SB 900, and it was a maternal health equity bill to have Hawaii start collecting morbidity data, which we don't do here as a state, and to disaggregate it so we know what's happening to communities of color here. And also to ask for implicit bias training and create a health equity task force. So I wrote that beautiful bill. It made its way through the Senate. It got deferred in the House with the intention of coming back in January for the next session. But the beautiful thing was, like, we pushed a lot of people here. So we had ACOG, on the, on the ropes, so to speak, to take a stand and, to support this work. A lot of the maternal health equity, not equity, but the maternal health collaboratives and task force and all the things here in the state really had to step their game up, because they weren't even thinking about these things. And two, didn't even know about the Black Momnibus at all, which is, problematic for a state that has the maternal mortality rates that it does for Black mothers here. So doing all that work on the policy side, but on the clinical side, here at Healthy Mothers, Healthy Babies, we just released our Mana Mama mobile clinic. It's a midwifery clinic that's pretty state of the art and pretty, pretty amazing. And it was built by the hands of, our team here at Healthy Mothers, Healthy Babies. It wasn't outsourced at all. So, and that van is going out to communities, particularly rural communities, communities of color, and seeing them and filling those gaps that they're getting missed at when they see their providers, especially now during COVID. So lots of work. So that happened. So let's see, October 2020 was first April 2020 was the economic plan. By that time, working on legislation, by October 2020, I wrote and put out a birth survey, for a statewide survey with the support of the Commission on the Status of Women, finding out what's happening to birthing people, because we just weren't getting information about what's happening in the hospitals during COVID.
Yeah.
Yes.
And that was, we got a huge response. We got lots of pushback from people who just didn't want to know, obviously, or were saying the state is doing fine and it's not a problem. The results of that survey, we put out a statewide report called Pushing Through the Pandemic, the Impact of COVID-19 on Pregnant and Birthing Women and People in Hawaii. That was put out in October 2020. And it was huge. It had huge recommendations. It had recommendations in regards to doula policy, recommendations in how we could use midwives better, a whole gamut of things. And with that report, I can happily say now that we were able to pretty much get all the hospitals here on Oahu to change their doula policies and not only let doulas back in, but doulas and a support person, so people can have two people now, all based off of that survey and that work. So really to be able to see, like, the work that you do and it actually has impact on, people's lives is pretty amazing. So it's, it's exciting to do all this work. And and to think about it, like, as I'm talking about, I'm just thinking about all the things that, have happened in that period of time. So, and that's just, some of them.
It is. Wow. And Kirsti, I just sent you a couple of pics of this. Like, is it a Mercedes Benz?
I saw the pictures of the van. Yes. Oh my God. It's amazing.
It's
so amazing.
Incredible. And
I will add them. I will put them up for the people watching and listening.
Yeah.
It's amazing.
I see like a beautiful, like, interior space where we have a little baby, and there's people where they can come. The Mana Mama mobile clinic. Yeah, I love that. I just love it. And there's actually a little news story we might link as well. But anyway, I've been seeing this from afar and watching you document these efforts, and I just always am like, wow, like, if we just, like, whatever Tanya's drinking, I want one of those.
Seriously, we need some of that everywhere. We need that in Athens. I can tell you that right now, for sure.
Yeah, for sure.
You think people appreciate it, but everybody doesn't necessarily. I mean, you have to think it pushes a lot of people's buttons, and people are like, who is this person? Like, why is she pushing? Like, why doesn't she stop? Or why does she keep coming? You know what I mean? Like, especially for industry that hasn't been doing their job and they're kind of getting called on it, and seeing how little, the quote unquote little person, like, Healthy Mothers, Healthy Babies is just a team of, 9 people, but all the work that we're able to do. So if we can do it, the bureaucrats and legislators can do it too, if they really wanted to, so to point that out and say, like, we are capable, we can do this right if we wanted to, in all the ways, from the feminist report all the way down to the Mama van, like showing like there are ways we can do this. I'm one person. Imagine if we were all on the same page and decided this is what we're going to do, take care of, mothers and babies and birthing people.
Yes.
Makes me think, one of the projects we discussed, Tanya, was sort of like a best practices. So taking a lot of, because to me, Tanya Smith-Johnson is leading edge, right? You're at the forefront, like few others, and you are pushing and you are defining and sort of what is not anything there. You're like, no, we're going to build this here, and this is how this should be structured. And I was just thinking that, like, you're doing the work. It would be cool, like big push, if we could like say, okay, you want to think about this and look at this, and here's a case study of that, and really connect the dots of what we see on the slide of like policy into practice, like to really get good policy, that to translate the vision and knit it to the ground is not easy. It makes everyone uncomfortable just about, but it's necessary. And it's difficult for you because it takes so much out of you to just continue with that intensity. But it's important. And I think you said that you're doing this, and the bureaucrats, they're just not kind of picking up what you're laying down. And I don't think, sadly, I don't have any expectations that they will. What I'm talking about is maybe something for other people in the States who could just look at sort of the cornucopia of what you've done and say, I could probably do that, or we could adapt something like this. But that's, I don't want to put anything else on your plate, but I do want to work with you on that.
It's always the thing, like when you and that's why I think we work so beautifully together, right? Like you have like this kind of big picture thinking, and you can see me in a way I can't see myself, and you can connect those dots in ways you're like, this is what could be useful. What about thinking about doing this, and and it'll help people. And I'm always, even though it is work, it's work that I'm willing to do because it's needed, right? And it's not just about me, right? So if I was in my ego, and if it was about like, no, like, I don't want to do that. I don't want to share information, or I don't want to tell people how to do what I do, but it's important. If this can be duplicated, across the nation, if every single state had a mobile clinic, every single state was, working on policy in a certain way, and we had a blueprint, it would make, those people on the ground, their work easier, just like what the Big Push does anyway in regards to CPM licensure. Like, it's important that people who are doing things, lay the path and make it easier for others to come up along and do it.
Yes. Do not go where there is a path. Go instead where there is no path, and leave a trail. That is like the quote of my life, but it's definitely the quote of your life too. And I just want so much to help pull down the fruits of your labors, Tanya, and make it accessible to others. And I feel like that is the beauty of the Big Push for Midwives. We have this incredible network, this incredible connectivity, and we're trying to make it more visible every day and every week and every month and every year through our different tools. For example, the Where's My Midwife crowd map. That is something that we discussed with Indra in Colorado about, and they would like to do a pilot with us. They would like to map not just the certified professional midwives, but map all the doulas, map all the lactation experts, the childbirth educators, the lawyers that provide services to midwives and families when they need them, because we know that they need them, unfortunately. So I think that's brilliant. I want to do that kind of mapping, and that's more aligned, Tanya, with what you and I envisioned. We need to show where the maternity care deserts are. We just were on, you probably saw this with Wendy Gordon, briefing Congress. As it's a subcommittee in House Appropriations. It has to do with midwives. It has to do about maternity care, and one of the Congress people is like, do you have that? Do you have a map of all the maternity care districts and where we don't have any providers, or where we only have a certain kind of providers, or where the birth centers are? And I'm like, wow, there you have it. Like, we're working on it. I'll get back to you. But clearly, if we could just show it better, it'll be great. And I got to tell you, the folks that host our Where's My Midwife, the grab map, they actually, they're the ones that created this incredible GIS software, visualizing geographic data, and that's what Johns Hopkins University used to map COVID across the globe. So I love them, and they just reached out to say, hey, do you want to connect some like monetizing platforms to your map? I'm like, yes. Yes, I do. So anyway, back to this, Tanya. I just love, and I do want to schedule some time to talk about what are all the things that need to be on that map, because like we have a chance with Colorado to kind of build a template, and they have these things in mind, but I think you and I have some other thoughts that I may not have written down about what else needs to be on that map.
Yeah, we talked about exactly that, right? Like, this was right after we came out of, that Austin meeting, right? Where I was like, we need a map. We need something that shows, that kind of overlays, things that shows where the deserts are and where the providers are and what,
Yeah.
And it's interesting that, Congress is like, does that exist? Where it is, where is it? And we're like, yeah, like, because we already knew ahead of the curve that it was what was needed, right? And and people don't respond to things until they can see it visually, till they see the data, till and you make it real easy, and like, oh, okay, that's where the maternal desert is. I see that now. What do we do about it, right?
Well, then
as opposed to like kind of talking. No, you're fine. Instead of talking about it in this kind of ethereal way, and people just can't wrap their heads around what you're talking about. When you have that map and you can click on it, you see this big swath of land that doesn't have people, and then you overlay that with where the CPMs are, where people are, and you're like, okay, this is herein lies the problem. So what are we going to do about it?
Yeah, the little pegs in the map, the little map icons that show that, oh, it's not, can't be licensed in this state.
Yeah. Yes.
Yeah. That was one of my biggest frustrations in North Carolina was, the medical society fought so hard to keep CPMs from being licensed. And yet out of the 100 counties in North Carolina, I think it was over 50 didn't have any kind of obstetric care. So people had to drive to another county just to be cared for. And the midwives kept saying, we can fill in that gap. We can drive to people's houses and help them with their prenatal care and help them give birth, so that they're not, crowning for 2 hours as they cross counties to get to a place that, you've decided is safest to give birth. So frustrating. And that there's so much research now to back the fact that, home birth is as safe as hospital. So come on, give me my license. Like, where are the licenses to support the midwives who want to serve? That was my other biggest frustration was, I remember going to the Push Summit. I was pregnant with my second child in 2007 and interviewing women, because that was when I first started realizing the scope of it, who had been arrested for trying to help women give birth the way they wanted to give birth. What the hell was that all about? Like, it just was mind blowing that we still have that issue is ridiculous, really. Yeah,
it really is. And I'm hopeful to support you, Tanya, and to support others on the ground. If we can better visualize it, then you can walk into your meetings with your policymakers and say, look, whatever the medical society is saying in your ear, however they're trying to strong arm you to resist, this is ridiculous. And you are here now. This is your position now to change this policy. So let's work together to do that.
Yes.
And I don't know how else to make it. I always tell this story. I am a communications professional. I'm a communications consultant in my heart. And I really thought when I joined this movement that they just need a one-pager. They just need to show these people, because surely these policymakers are not driven by anything other than evidence, right? Yeah. Sorry. It drips out of me sometimes. What's that next slide, Kirsti? I'm curious.
Let's see. Oh, okay.
Love it. So
Mhm.
yeah, it really is this is something that maybe should be said, may be so obvious to us because we're here in this space so much. It's so clear how the pandemic has had this unexpected silver lining as it relates to midwifery and birth. It's so obvious to us that this is really making way for midwives, this pandemic. It's helped in a way that I didn't see it right off. And I think I started to get it in April, and that's when the crowd map came to be, but of 2020. But I love what you did, Tanya, with this recovery plan, and it bears repeating. What you did was they asked you what's best, and you said, look, midwifery. Bake it in, weave it in, you said, and you did that.
Yes. Yeah, when I was, given the platform to be like, hey, tell them, this is your opportunity to tell it and tell how we do this better. So how do we do it? And I was like, are you sure that's what you want me to say? And yeah, and so I wrote all the things, and all of us, know, like we need to, have CPMs, implemented into our care program. We need them to be covered by insurance. We need, to doulas to be considered part of the healthcare team. We need to change policies, all of these things that we talk about, within this, midwifery world. And we know just bringing that to the, to the bigger picture and the larger scale, especially, with COVID, to show like, hey, like, especially here in Hawaii, like all of the hospitals are here on Oahu. So anyone who's laboring, on the outer islands, if there's anything that happens, they have to fly in here. That just shows you how, even just with the doctors and the OB-GYN force, how they're so few and far between. And the more rural you go, like people don't have access. So that was already a thing before COVID. Then once COVID hits, and then the hospitals here, since we have so few, had to transfer their, maternity wards into COVID wards. We saw our numbers, starting to go up. And, of course, we're like, this is the worst thing that can happen. But in ways we're like, this is where we can this is where we can say, look, what if we thought about, if we have to get there, having, midwives, having these kind of mobile units? What if we took, since our tourism industry is down, what if we were able to take hotel units and make them into birth suites? Think big, think about what are the things that we can do and we have access to. What happens if, all of our hospitals are shut down with COVID? People are going to continue to birth through COVID, babies come regardless. So what's the plan? And the state didn't have one. The state wasn't even thinking about it in those ways because mostly, legislators are men. They're not thinking about, birth and birthing people at all. They're not they're not connecting the dots, and so, and not just in regards to maternity care, but just all the things, and not seeing how, women and children are, impacted in these ways, not seeing, all the things on all the levels, the implications of that, and to create a policy, economic policy, determining where the money goes and not think about those things, is disheartening, frustrating, and abysmal. You can't. So this plan was, most of the people on the team, were women. Most of them were women of color. And so this was our opportunity to say like, hey, to be, the voices that normally don't get heard in these spaces, to lay it out on the line and say like, this is what we're saying from our place and where we stand in these spaces, what is needed. This is what you're not doing well. This is what you're not thinking about. Have you thought about this? These are the ways we're going to lay it out for you to make it easy so you don't even have to think about it. This is what we need to do. And also, and thinking about not only, the current moment, we were thinking about the future once we came out of COVID. So not just saying we wanted it to be a temporary fix for now, but how do we not go back to the status quo, and particularly in regards to maternal health care? How do we, we pivot, we make it better, and that's just what we do from here on out. Like we cannot go back to how it was before. So what do we do? And that's how it was written, and there are certain groups here who got upset about it. ACOG was one of them. They wanted to go to the governor and all this stuff about the report. And we're mad because they weren't part of the team. And we're like, you had your voice. You have your voice all the time. Like, why do you need to be a part of this, and speak more and take up more space? Let us speak. And that's what we did. And, in most places outside of Hawaii, I thought was great and amazing. It's interesting that even on our kind of local level, it was kind of like ignored, we kind of, we didn't expect it to the degree that it is, but like where everyone around us, wants to, make policy around it. But for the most part, Hawaii, didn't. So, and that was something we had to express, like, especially when I was talking, to the UN, we're like, pat us on the back. Yeah. But like, it's still a work in progress,
Did Kirsti, did she just say she talked to the UN?
I know.
Okay, you cannot breeze that one by. You got to tell me what that's about. That's exciting. When did you talk to the UN? And tell me more.
That was this past March 15th. So just a few weeks ago. And we've gotten lots of like requests to, from various different countries or places to talk about the report. And I was given the opportunity to, be one of the people to speak at the UN Women meeting in regards to our feminist recovery plan, and really, talk about the piece that I did. And more so, and I didn't think about it this way until someone said it. They were like, your part of the plan is the only part of the plan that actually came to fruition, that actually happened. It became more than just theory and a policy where it's actually able to be done. And I was like, oh, I didn't think about that. We were actually able to, change doula policy. We actually were able to upscale, midwifery model of care. We created this van. We created a food program for, pregnant moms and babies and families. So all of the things that we actually did boots on the ground, were contingent on that plan. So it actually was the best example of like how you can take policy and put it into action, how you can merge grassroots organizing and community organizers with legislators and policies and figure things out. And then two, is the part of the plan that wasn't contingent on that. It wasn't contingent on a law or a bill or anything passing. It really was the work of, changing, policy on the ground levels, making hospital administrators look at what we're writing and change their policies before we had to go to the executive, order, route, like what can we do before we get there? Because this may not happen. We might not get that executive order. So how can we do this and get it done now? So like being, in that, kind of expert group meeting and having all these, PhDs and policy people from all over the world, talking about their papers and stuff, and really, them taking what we wrote in that report and studying it, and doing these, white papers on it, was fascinating, and normally in those spaces, you don't get to talk to the grassroots person or the person on the ground who's actually doing the work. So to be, not only just that grassroots person, but also the policy person who's pushing on this other level. So they got kind of both lenses of it, and have that person sitting there talking and telling them how they can do it too. Was beautiful. Yeah. And it was well received. And it was an honor to be able to do that.
Wow. Love that. I just love that you were able to do that. And with regard to the recovery plan, I mean, I'm not surprised that your piece is the only piece that got like really going and going, with traction. But I feel like that could be a real starting point for what I was sharing about in terms of what we'd share with other advocates who are working, just to give them, the at a glance menu of what they could be pushing for. Thank you so much for that. Kirsti, what's our next slide? We've talked a lot about this, but I just want to have you tell us how unique this coalition is and the work that you're doing.
Yeah, Healthy Mothers, Healthy Babies Coalition Hawaii, it is a nonprofit. Once upon a time, like all the Healthy Mothers, Healthy Babies, there were one in, each state had one, and it was more, of a kind of connected coalition. But some states stayed part of those coalitions, some didn't. And so we're just a nonprofit. We have a small and mighty team, tiny and mighty. And we've been able to do some amazing work, and it's amazing what you can do when you put a good, solid team together. So we have a team. Our clinical team, we have 3 midwives. They're all CPMs, myself and 2 other CPMs. We have an APRN, and we're the ones who really have been building out this clinical portion for Healthy Mothers, Healthy Babies. Before then, it was just mostly social services. So safe sleep program, the tobacco programs. But we really, kind of pivoted in the moment, and we became doing like rental assistance for, our families, connecting them with WIC, but also, making sure we created a Mana Eye Flu program where we were giving out, meals prenatally and postpartum, where people were getting a week's worth of meals and they were delivered to them to their door. So really just, kind of, really our main focus is to wrap people around in our social services, but with the addition of the midwives to have this clinical portion to where we can fill those gaps. So people are, here in Hawaii, unlike most of the country, most people here have health insurance, so it's not an insurance issue. You'll be hard pressed to find someone who doesn't have health coverage, but of course they can't access midwives that way. They can't access CPMs because we're not covered. Of course, that's a fight that we're working on, and everybody's fighting on that, on a national scale. But to where we really feel our place is to where, for those clients who, are missing appointments, because that's a big deal here. People just don't go to their appointments because they don't necessarily like their providers, or, don't feel seen and heard, to where we're the ones who, like, we can see them in between those appointments, where we can see people between the time they have their baby and they don't see anyone till their 6-week appointment, where we're actually giving them the midwifery model of care, and we're seeing them all those visits and going to their home, and they have lovely, we bring them food and have these lovely, lovely appointments, to get seen in those ways. And since we have an APRN, our scope is big, so we can see people, for, well person, well family visits. We can follow children out further than CPMs can. So yeah, it's a beautiful program, that we set up. And then on top of that, making sure that they are, they're getting childbirth education included. We have a community-based doula program that we started. And so when people like pretty much, come to us, they're literally getting all they need in all the forms, to take care of themselves and have, the not only the best pregnancy they can have, but just, the best, family and wellness possible during, after, and, even past their postpartum.
This is so cool. And this is actually a piece of what we did together in the fall of 19. We had a working session, a brainstorm session at the Push Summit, where we had, it's like a wagon wheel on its side, and it's a continuum of maternity care. And I love, Tanya, how many wedges you're filling through this work. So Kirsti, I'll make sure we throw that up on the screen for everybody. But this continuum of care idea is a real insightful way for all practitioners to think about where they fit, where they fall short, where they could let something go to another practitioner, and where they could sort of weave everyone in together, because that's what this should be, for the seamless transfer of care and just making sure fewer people fall through any gaps. So I feel like it's brilliant what you're doing, and it's just, again, leading edge. And we're so grateful for your leadership in Hawaii, and I do feel like other states will benefit from it for sure. Yeah. I'm not sure. The next. Oh, I did throw up the Healthy Mothers, Healthy Babies logo there. It's very pretty. She has like a little flower in her hair.
Yeah, I love it.
I love it. Okay, so the next slide. I want to know what we said. Oh, well, so this is what we've been talking about. New progress. This is this creative strategy and grassroots organizing. And how would you describe the grassroots in Hawaii, Tanya?
I would say here, Hawaii is a place that has lots and lots of nonprofits. So a lot of the work that happens is through, kind of this nonprofit, lens. So, and pretty much that's where you'll find all the community workers and organizers. And a lot of them, do the work in which they're part, so that's, why the seat I have on the Women's Coalition is so important, because, your nonprofit can be there, and that is the coalition that presents legislation or any kind of policy. And so really you're getting, even if you're like this kind of community organizer, grassroots person, you can get a glimpse into what's happening in the legislature, what you can possibly write a policy on that may benefit your organization or the community that you serve, right? So, and I feel like people are really interconnected in those ways, through various different kind of coalitions or the work that they do. And then really just, finding, especially, people who are, like, for instance, serving, women and babies. Like, we all have, different working groups, and we all come together and like, what are you doing? What's going on? How can we help? And really, I would say the key, especially here in Hawaii, is, just collaboration. Coalition building and collaboration are the key in what gets things done here, more so than on, this bigger kind of government level.
Excellent. Well, one thing I did want to go back to, I didn't want to overlook what you were saying about the kind of care you were providing in the mobile clinic. And Kirsti, I will say, you guys are of the same heart in terms of how important social services are in that wraparound approach. And Kirsti, if you could just share a little with Tanya about the vision you have for the centers you have. I actually think you share the same vision, and I've been looking forward to our conversation.
Cool. Yeah. Okay. So I don't know if you know about the original Where's My Midwife was a group of moms in Wilmington, North Carolina. There was a practice of certified nurse midwives who were fired because they were growing their practice and they were threatening to the obstetricians. And they tried to say that it was for some BS reason. But all the moms who were, expecting maybe their third child with these midwives, suddenly maybe 9 months pregnant, had no midwife and were expected to just suck it up and go to the hospital and be with some strange provider for their birth. So at the time, I was already advocating for CPM licensure, and the childbirth educators and doulas in the community were like, what are we going to do? So we did this whole campaign where we protested outside the hospital just to get a meeting. They wouldn't even meet with us to find out, why did this happen? Why are you denying us access to midwifery care? And then it was an email campaign. And then we delivered a binder of letters to the OBGYN group at the hospital and said, can you just read these and understand why midwifery care is so important to us? And the CEO had some choice words for me. And then Susan Jenkins came or called into a meeting. We finally got a meeting with the CEO, and we sat down, and he basically was like, no one's ever said anything to me about needing midwives in our community. And I think you're all just full of it, basically, and tried to blow us off. But they ultimately did change a policy at the hospital that required obstetricians to be at the hospital while the midwives were with a laboring patient, which was ridiculous. And of course they didn't like that policy, but they created the policy. So it took, like you're saying, it took people on the outside to put public pressure on the hospital to change that policy. And then once we did that, we started asking questions like, well, where is this happening? And we realized that nurse midwifery practices were being closed all over the country because the midwives can't say anything to the obstetricians when they're being, pressured in whatever way to close practice. They just shut down and go someplace else. And I was always like, well, no, that's not okay. And where are the moms doing something about it? So we all kind of were like, well, what's our ideal situation? And because there's only one hospital in Wilmington, North Carolina, you have to give birth in whatever way those physicians decide it's best for you to give birth at that hospital. And it served the 3 surrounding counties. So needless to say, it was not the ideal situation. And so we envisioned basically a birth and wellness center that was run by midwives and social workers. And, you'd have a typical birth center where the midwives provided care for, well woman care all the way through, prenatal, postpartum, labor, everything. And then, all the way through menopause, like the whole gamut of women's wellness. And then you'd have a wellness center where you'd have social workers who helped with, prenatal support groups and postpartum support groups, new parent support groups. You'd have, peer run breastfeeding support groups. You'd have prenatal yoga, like anything you could possibly imagine. And we need these in every community. That was sort of like what was, for me, the seed that I took from the whole experience was that we're just doing it wrong right now. We're just, the system doesn't want to be changed. I had an obstetrician tell me one time, he was like, we did the play Birth by Karen Brody. And afterward, he was on the talkback panel and he said, everything that you're saying is true. Women are being mistreated, but we're making a lot of money. And until somebody tells us we need to do it differently, then it's just going to keep happening. And I was floored that he was so honest about it. Yeah. And so I was like, well, shit, we need to get more moms out in the streets just demanding to be treated better.
Yeah.
And so, yeah, like just the idea that this system is falling apart. I spent 10 years trying to fix it and I gave up. I was like, no, I got my master's degree in social work. And now I'm like, you know, the ideal job for me would be to work in one of these birth and wellness centers with midwives. And, you know, you'd have social workers who were doing the social justice component, and you would have social workers that were working out in the community to make sure moms were supported in the way that was appropriate. And with the mental health issues, you'd have therapy. And I just feel like that the way that social work views the world is holistically, which is exactly the way midwives view the world and people, that you're not just, you know, a person who needs to have a baby extracted from them, that you are an entire system unto yourself and you are interacting with all of these other systems. And, you know, that's complex and beautiful. And we need to honor and respect that and put women and people who are giving birth back at the center of the care. It's not about the physicians or the people doing the work. It's about the people who are creating families. Like that's where the focus needs to be. And I've just yammered forever, but like, that's my vision. And that's
do you want to come to Hawaii then? No.
I would love to come to Hawaii.
We actually do that. So Healthy Mothers, Healthy Babies, we have 3 LCSWs on staff, and that's exactly what they're here for. So yeah, I say wrap around, like it's completely wrap around.
Yes.
We, I mean, pretty much any kind of social service that you can think of, we're doing it. And I think people don't realize, especially like legislators, when they're talking about like the people who do that thing, I'm like, that's us. Like we're those people who are doing those social services that you're talking about. So yeah, so we have parent groups, we have our clinicians, they have space here. A lot of them have pivoted to just doing telehealth, but they're, you know, since Hawaii is doing better than like the mainland, they're gonna start coming back into office to see people.
Wow.
So yeah, and where they're here, like, so literally from the moment we have, you know, a mama, a birth in person, we have like this kind of master form, and it asks them about everything. Like, what do they need? We just had a meeting where we're looping in our childbirth education as a part of like our doula service and doula program. So pretty much, you know, if you're getting a doula, you're automatically going to get, you know, those 8-9 hours of childbirth education. So things aren't so compartmentalized anymore.
Right.
Where we're taking care of all the things. If you need to see, you know, our lactation person, like she's on deck. If you need to see, you know, an LCSW, she's right here. So really just trying to think all the things. And the only thing we're missing is the birth center. And we're working on that because Hawaii just got, you know, licensure to where it just got implemented starting last July. So it's fairly new here. So like even that hasn't been thought about. I think people have been wanting birth centers here in Hawaii for a while, but I think now it's like actually a thought where it could be a reality, to where people are like, okay, so how do we get this done? Like we have a midwifery advisory council set up, but they haven't started working on regs yet. Like due to COVID, they just started, you know, got set up in the midst of COVID.
Yeah.
So about what all those things are. And I think, you know, one of the conversations we're having is like, we need a birth center. That's the
How are the birth center regulations and how are the birth center regulations in Hawaii, Tanya? Because I know we don't have them. Wow. So that actually may not be so bad. And here's why I say it. Because the ones in Missouri are like ridiculous. You got to basically be like a hospital. That's it.
So that's why I say, I was like, it's actually, you know, like, so we're like this kind of clean slate, and we're like, we're like 10 years behind everyone else. Right. So like, we're just now like, okay, we're licensing, you know, midwives, but no one even thought about like the birth center component, you know? So we're kind of like, okay, like maybe we can sneak this in here and like figure out all the ways that it went wrong other places, or how do we make sure that we're ahead of the curve as far as like the regs and all these things, so we can make sure it's not, you know, an obstacle that makes it to where we can't do it. Right. So we're it's just like now at that place.
I'm so happy for you.
I love that. Just love it. I just love it. It reminds me of that story I heard from a guy who was like at the intersection of globalization and militarization, and they were talking about Afghanistan. And basically when we got there, which is a whole, issue of why we're still there. But in any case, they got there and they wanted to like get it linked up for telephone, right? And his point was they didn't go back and put up telephone poles and wires. They leapfrogged right to wireless. So in many ways, you don't have this ridiculous infrastructure of a crap policy to deal with. You have a green, white box or green field, or, and what a blessing, because you could basically say, we're going to avoid a lot of pitfalls that other states, barriers to building, barriers to succeeding. So it's almost like you have another opportunity in front of you, like you need another one of a perfect birth center policy.
Yeah.
More on your plate. Damn it.
Yeah, it was already there. We just like, I haven't taken a bite out of it yet, but it was already on the plate where we're already thinking about like, what does that look like?
It's coming.
Because there's no birth centers in Hawaii at all, not nurse midwife, no kind of freestanding birth center whatsoever.
Wow.
So what does that look like? I think there might have been one on the Big Island, but it got destroyed when the volcano erupted. So there's nothing.
Yeah.
There's nothing there. So
Pam Marath, I always try to remind people, Pam Marath, one of our founders of the Big Push, and she really believed for the decades that she served this movement that birth centers were the key, that CPMs would not be providing as much birth in private homes, that it would be birth centers that would really just be that wave that more and more women would welcome. And I do think the model you guys were talking about, this birth and wellness center, the wraparound services, is the thing. It has to be the thing. And I know it's more complex. It's, more thinking to overcome an existing status quo, but we know that there are savings. Like we get this opportunity to talk with Betty Ann, David Anderson, and Ken Johnson about their paper that shows that literally if we just make nominal increases in the care provided by midwives in private homes and freestanding birth centers, that we're talking about $10.46 billion of savings to the systems. And again, that's like really conservative. So imagine if we really thought big, like you say, Tanya, we could do so much with so much less money. And that's what that guy, Kirsti, was talking about, right? We're making too much money. We know how much money the hospitals are making. And did you guys hear this? I'm following this now. This has to do with how hospitals have to publish how much things cost in their facilities for various procedures and for various patients, because it can vary. At the very same hospital, the cost of a C-section, for example. But it's
based on who's paying, right?
Yeah, exactly. And did you know that they are doing things to their code on their website? So the search engines can't pick up those things that they say that they're publishing in a transparent way.
Of course.
Isn't that lovely, those hospitals? I tell you, we need more Captain Americas out there with your shirt, Kirsti, because this kind of ridiculousness. Let's talk about something refreshing and uplifting, which I think is on the next slide, about workforce. Tanya, before we wrap for today, I want to talk about what you're doing, which is so important to create the next generation of midwives.
Yeah, so for me, it first started with creating a NARM study program. So way back in 2016, still, a student midwife, and I was asked to possibly do a presentation for a local regional midwifery conference that was a /MANA conference at the same time. It's my first conference. I'm like, sure. And that conference, my presentation was on how do we, uplift the force? And one of the things I said is that we need a NARM study program that's specific to students of color. If we're seeing that midwifery students of color are having a hard time passing the NARM for whatever reason, why don't we have something that's specific, to them? And it was just one of the suggestions I made. And at the time, lots of people were in the room taking note of that, right? I think at the time, the only real thing that was out there is Mercy in Action. So, and so, yeah, and it, Mercy in Action is extremely white. It's in Idaho, and from what I know of lots of midwifery students of color, was like they just didn't feel comfortable. They felt out of place. Even if the material is great, right? Like there's a certain component as being a midwifery student of color. It's where it's so isolating, because school is mostly online. You're in clinical practices and apprenticeships with most of the time white midwives. And so there's never a touch point where you're with other students of color. And then on top of it, you're trying to pass this really ridiculous exam, right? And so from that, fast forward, I'm a part of CAM, which was California Association of Midwives, and I'm brought on. And at that conference, I was asked like, "Hey, do you want to like make this happen? Like, let's talk more." And from there, like join CAM, and that was like pretty much the gist of like the work that we did. And for me to kind of really just kind of program, direct, and figure out, how do we, do this idea I had, like many of the other things, right? How do you make it come into fruition?
Mm-hmm.
And I did that, and it was great and amazing. And we had midwifery students come. I helped organize it. It was like this little seed and baby that took, and we put together, a great team to bring it together. From there, here recently, last December, I guess my name was kind of buzzing in people's, ears in regards to teaching at a few different midwifery schools. And I kind of got the word like from, other midwives, like, "Hey, would you be interested? Such and such place is looking for, a teacher." And at the time, it was one of those other things that I kind of wrote and manifested. It's like, I would love to be a teacher. And here I go, come, December, I'm getting calls about, being an advisor or mentors or being a teacher. And got calls both from Midwives College of Utah and Florida School of Traditional Midwifery. So since then, it was a really quick onboarding, and I started teaching this past January. And it's been great and amazing. I've been teaching, for a few months now. At Florida School of Traditional Midwifery, I would say a good half of my students are particularly Black midwives. So, Florida has its own history of midwifery and how it does it. Florida is probably the state that has the most Black midwives there. So really to be a teacher who's teaching these students in their core classes, like I'm teaching anatomy, physiology, microbiology. So they're really, core classes. This summer, I'll be teaching reproductive biology and pharmacology for them to really like take these year one students and be the professor that is, guiding them, on their journey has been pretty amazing. And then too, to like, for those students to see a Black face, not just the Black students, all the students to see a Black teacher, because I'm, one of the first, so just having that kind of grounding and knowing someone who recently, was just a student who just took the norm, who understands that, and really kind of guide them in this way. And then too, like coming from it, not only am I a midwife, like I'm a scientist, I'm a science background person. I have a degree in biology and a master's in medical science. So this is something I love, so like I think most of the things when they're like looking for, midwives to teach, most midwives are like, I can't teach that, I can't touch that. But for me, when they're coming like, do you want to teach like obstetrical pharmacology? And I'm kind of leaning in, like, tell me more, right? So they were like excited. They're like, oh my God, like whatever you want, like come on and teach. So yeah, and then with that, I was asked to if I would consider being what we're calling the IDEA advisor. So it's the Inclusion, Diversity, Equity, and Accountability Advisor, because really the students at this school ask for this. They ask for someone who they can go to. They want the school to be accountable to them as students of color. How are they going to help them get through? Especially with all the things swirling in midwifery and outside of midwifery, right? In regards to, racism, white privilege, in all of these places, right? Midwifery, it isn't, excluded from those conversations. And for students to, to express like what their needs were, that they would want to, have, someone there who's there specifically for them and can hear their needs, have teachers there who, look like them, and can really guide them what's important for them. So yeah, so to be able to step in, in Florida School of Traditional Midwifery in that way has been amazing. And yeah, like every moment I get to teach them, because that school, they actually are with me live every week, for 2 days, so Monday and Tuesday, I'm teaching them for a few hours a day. So they see my face, I'm talking to them. So it's not just all like kind of online. And so it's been really great having those touch points with them and have those students. Some of the students were crying when I first came on because they didn't know, and like the school announced, and they saw me and they're like, oh my God. And like in our chat, people were just like, oh my God, I'm so happy to see you. I'm so happy you're here. And after the first class, we're like, thank you so much. You all have no idea. And then like just getting those emails from them was beautiful. And I cried, like, I was like all nervous, like getting ready to teach because I understand how important it is. The place that an educator and a teacher has in all of our lives, right? Like we remember that good teacher, we remember that bad teacher, we remember the teacher that uplifted us and told us that we can do it, and remember the one that told us we couldn't, so yeah, so being there and being able to do that has been amazing. And then also I'm at Midwives College of Utah and I'm teaching their NARM prep class. So really being able to take like what started from that NARM retreat and really like pivot into actually teaching the class for students and helping them along is, pretty amazing as well. And over there, I'm also teaching pharmacology class. So yeah, so teaching in 2 places and all the things, and it's, it's work, but it's beautiful work. And that's how I feel about all of this that I do. I know people look at it from the outside and like, that is a lot. And it is a lot, but it's just beautiful. You know what I mean? So when things are beautiful and they're your passion and they're actually things that you asked for, like I asked for this, so I can't be upset about it. I wrote it down and said, these are the things that I want. These are the things I want to do. These are the things I want to be a part of. And when those things come, even though they all came rushing at once, like all like within like the year, all of these things have happened within the course of 1 year.
Wow.
It's been, I have to take it and just, find myself, really blessed, and it's an honor, and I'm extremely humbled to be able to do all the things and to be able to just represent people, to be that person who's representing in the room. So that's why I when you saw me at that push, conference, to where I had that presence, because I'm representing not just myself, I'm representing so many people who are never in that room. I'm representing people who never get to speak and get heard. So I have to have that kind of grounding, and I have to stand up and be like that. Whether I feel like inside I can or not, I have to be unapologetic when I speak for, student midwives of color, other midwives of color, speak as a Black birthing person. I have no choice. So I can't step in those places afraid. When I sit there and I'm in hearings with the legislator, I talk the same way, and people, look at me the same way, like, who is she and where did she come from? I have to represent, because these are places where most people don't even have a seat at the table and a platform. So I have to advocate in all the ways as hard as I can while I'm there. So yeah, so that's another thing, another hat that I'm wearing, and it's a beautiful hat, and I extremely enjoy it. I enjoy it a lot more than I ever thought I would. I never thought about being a teacher like in this way necessarily before, and that I would love it as much as I do, but I do.
Amazing. Thank you for what you do. It's so necessary. So necessary.
I think of you, Tanya, as a magical being, and that sounds a little woo-woo, but you're just so attuned to the currents, to the flow of this work. I think, you're just an embodiment, 100%, just 100%, and I'm just so grateful that you exist.
Yes.
That you get to do everything that's coming through your heart. And I hope if there's anything I can do to help, I was thinking of how we could just share that little snip with so many young ladies. I wanted to ask you if you could just talk to how important this next generation of Black and Brown midwives is. I mean, what Congress is hearing is that we need more midwives, more and more and more. The workforce is insufficient. The Momnibus needs to add schools of midwifery to its funding. It does not currently include it in the current version. Schools of nursing are funded. Other schools are funded, but there is a missing chunk of schools of midwifery to be funded. So I logged in and entered my comment and wrote what I thought the policy could be to mirror what they are, the equivalent of $15 million is what they're putting into schools of nursing. So why not $15 million into schools of midwifery? But I just so want more funding to be able to come. And that actually brings us to our last main topic of conversation that we had discussed, which is your new work with the Birth Future Foundation.
Yes, that beautiful baby that has been born and is out there now. Yes, so I'm a co-founder of Birth Future Foundation, and it's another place that just kind of fills my heart, and working with the wonderful women who are part of who are the other co-founders and a part of the board has been amazing. We were working together as a part of FAM. And we left together to start, something new, something that we felt was more centered in, racial justice, that was more centered in decolonizing what philanthropy and grant making looks like, where we really can work in the ways that we feel would uplift midwifery and the force, without constraints. And really just being able to dream, and I think that's the undercurrent of all the things that I'm doing, being able to really envision something and dream of what it could be, and then actually being able to make that happen. And that's what we're trying to do with Birth Future Foundation. As co-founders, we want funds to get to the people on the ground who are doing the work. We want, student midwives to be able to do this and be sustainable, as a midwifery student, who probably is more privileged than a lot, because I have a husband who's military. I don't have to worry about insurance. I don't have to worry about a lot of things. So I didn't have to work as I was doing my apprenticeship, and it still was hard. It still was extremely hard. Having children and thinking about childcare and all these things. So, even like thinking about how do we help uplift the force in the ways, like how do we support the students that we already have who are going through the pipeline? What does that look like? What does it look like, for us to support, those organizations we know are doing the work, but just can't tap into the bigger funds? Those funds go to, other organizations, and it never trickles down. And as you see on Facebook, various different organizations or individual, student midwives asking for, help to fund their education, or help just so they can continue in their apprenticeship, or help so they can do whatever grassroots work they're doing. So, Birth Future Foundation wants to be, a fix for that, wants to make it to where there aren't so many strings attached, to getting that funding to, boots on the ground people who are doing it, especially, communities of color. They're centered in all the work that we're doing. And you see that in our launch, like where we pretty much were like, we are going to just tell it how it is. We're going to tell you what we're about. We're going to tell you what we are not going to do and what we are going to do, and either you love it, like it, or leave it. This is not a place to make white people comfortable with the money they give, but being able to tell us what we're going to do with it, and who to give it to. That's what happens in lots of other organizations, and we're not doing that. So we're still in baby form. We're in the process of really, laying out what our grant making will look like and all the various different programs we want to do. But yeah, that would be the intention, to where we're here to support students. We're here to support midwives who are on the ground, so they can make things sustainable, who have their birth centers, who have their practices, who are doing, amazing work through their nonprofits and foundations. How do we support and fund them?
Yeah. That's amazing work. It's just incredibly important. And I will advocate on this in this conversation as well, that we need to fund birth. We must, and we're so grateful that the Birth Future Foundation exists. But this work, it's so important. And it's so striking how much reproductive justice doesn't mean birth in the United States. And I still want someone to come on the Where's My Midwife, a podcast, and let me know, because I'm really, really wondering about that one. But thank you so much for all of this work. I want to like invite you to come back so we can talk about some of these other projects. They will continue to unfold, like where we can really use so much of what you've done in the last year alone as a blueprint. And I know there is a blueprint that people have talked about in the movement. There is something equivalent, I've heard, for the CNMs potentially, or maybe it was actually not that. Maybe it was the doulas. Do you know of what I speak of, blueprint for doulas? Have you heard of such a thing, such a document? I was on the phone with like Carol Nelson, right? Like old school Tennessee, you know, amazing school of midwifery that they're creating there. We need to have her on. And she basically suggested that there needs to be a blueprint for CPMs that describes how it should integrate, that describes how it should function with these kinds of birth and wellness centers, that describes every inch of it with regard to, you know, insurance and the birth center policy. I mean, like everything. So
I agree. Another project.
Project. Okay, write it down. Tanya Smith-Johnson, I want to hug you so tight. And I'm so appreciative. Yeah, I'm so glad.
Grateful for
we had
you.
this day
Absolutely.
together.
Thank you.
Be
Thank
blessed.
you. It's been lovely
everything.
talking to you.
Yes. Thank you.
Yeah.
Thank you.